Definition of health education. Health education is the process of providing information, motivations, and help to adopt and maintain healthy habits and lifestyle. Principles of health education. Two of the principles of health education are based on the fundamental principles of general education and behavioral sciences, which are as follows. Motivation. To reduce the desire to learn is motivation. In health education, people are motivated to accept new thoughts, habits, and activities. For example, child can be motivated to adopt good habits by praising him. Interest. The person should have the desire and interest to learn. Desire for health education can only be created when it is connected with the needs of the person. For example, child education is polio vaccination health education, and sex education for youth. Learning by doing. A person can learn better by doing things in place of hearing or seeing. Next one is participation. This is a psychological belief that when a person participates in a work, then he accepts it willingly and recognizes it. Work group discussions, panel discussions, workshops, drama, etc. are different instruments for health education, which give participatory education to the participant. Comprehension. The health education should be planned after knowing the mental ability of the person, his learning capacity, his education background, in the manner. The medium of health education should be community's language. Good human relation. It is necessary to have cordial, friendly, and kind relationship between the teacher and the person accepting health education. Communication. Health education is two-type process. Hence, communication's language should be simple between communicators. Repetition. Most of the people do not understand new facts in one attempt. Hence, repetition is necessary for effective health education. Simple to complex, normal to abnormal, and known to unknown. Health education should be provided from simple to complex, normal to abnormal, and known to unknown. Planning. Planning is essential for correct implementation to achieve good targets and goals. Next question is different methods of health education. Uh, Definition. Methods for health education are the ways, techniques, or procedures used to communicate health information and teaching to people in order to improve their knowledge, attitude, and procedures regarding health. Next, media for health education are the tools, materials, and channels used to communicate health messages effectively to individuals, groups, or the community. Classification of methods and media for health education. Health education methods or media and methods for health education is divided at three levels. The three level and these three levels are health education methods at individual level, health education methods at group level, health education methods at mass or public level. Health education methods at individual level. Health education at individual level is the process of giving health information and guidance to one person at a time according to his or her needs, problems, and understanding. Methods used. Face to face or personal contact is the main feature of individual health education. It develops interpersonal relationships or nurse patient relationship. Interview. Asking and answering questions. Counseling is also an effective tool for providing health education and emotional support. Home visit. Teaching at person's home. Personal guidance. One-to-one instruction. Next, short message service. SMS through mobile can also be used for conveying health information. Health education at group level. Health education at group level means giving health related information and guidance to a small group or large group of people at a time instead of one individual. It is commonly used in schools, community, and hospitals, etc. Methods used. Lecture. One person explains the health topic to the group. The points to be considered in the lecture method are given ahead. The lecture should not exceed more than 50 to 20 minutes. The lecture should arouse interest in the people. It is also called talk and chalk method. Talk is concerned with the speech ability, while chalk is referred to board or visual components. Next, demonstration. In this live exhibition of the topic of health education is done. Example: use of toothbrush, sewing, and washing, etc. Role playing or drama. Expression can be more impressive than words, and acting also more effective. Keep this fact in mind. Acting or social dramas are staged or played health education. Workshop or seminar. This has proven to be a novel experiment in education. In a workshop, participants are divided in small groups, and each group is assigned some special task or solution of participant particular problem. Each group has a leader and a recorder. Panel discussion. In the panel discussion, 4 to 8 experts discuss on the given subject in front of the audience or the group. Its features are there is no special agenda. Listeners can sometimes ask questions. Discussion is focused on one subject. The discussion should be easygoing, natural, and inspired. Health education methods at public or mass level. Health education at mass or public level is the process of providing health information to the large group or to a large population at the same time through mass communication methods at the same time through mass communication methods. Method use mass media. Definition: mass media is a medium of communication that reaches and influences a large number of people. Mass media and health education. Mass media play an important role in health education by spreading health information to a large population at the same time. Mass media for health education helps in creating interest, promoting health, adopting good habit, educates people about nutrition, hygiene, and safety, changing attitudes, adopting healthy behavior, changing lifestyle, etc. Types of mass media. Broadly, mass media can be divided in four types: broadcast media, print media, outdoor media, আর হচ্ছে digital media. Broadcast media is the essential part of our daily life, which provide health education through audio visible medium. Some important broadcast medium are radio. Radio is an essential audio mass media tool used to communicate information to a large number of people through sound and voice. Role in health education: spreads health education to create health awareness in rural and urban areas, gives information about nutrition, hygiene, vaccination, etc. Delivers health talk, interview, and public service announcement. Cinema. It is a very effective and extensive medium of not only in health education but even general education. Television. Television has emerged as a powerful instrument for knowledge, behavior change, etc. Print media. Print media are forms of communication that provide information through printed materials or paper to reach people. Example: newspaper, books, journals, magazines, etc. Digital media. Digital media are forms of communication that use electronic device and the internet to share information in digital form. Example: social media, internet, mobile apps, YouTube videos, websites, etc. Outdoor media. Outdoor media are forms of communication displayed in public places outside buildings to reach a large number of peoples. Example: hoardings, posters, banners, bus panels, kiosks, beams, billboards, signboards, etc. Define communication. It is another question. Communication is a full two-way process where in one person conveys his thoughts and feelings to other person who interrupts the message and responds to the same communication. It can be verbal, written, or non-verbal. Types of communication. Types of communication can be classified in two categories. One is fast communication. Second communication. Fast communication on the basis of relationship: formal, informal. Formal, this is a communication given under the organizational structure. Informal, this is the structure in which individuals carry our social and unscheduled activities within the limits of an organization on the basis of direction or flow. Downward communication, this communication flows from top to bottom and the main objective is to convey orders, directives, instruction, etc. Next, all upward communication. And this communication is from the subordinate staff to the superior, which flows in the form of reports, complaints, and suggestion. Message runs from lower level to higher level. Horizontal communication. This is the exchange of information between individuals of the same status or designation on the basis of expression. Non-verbal communication, verbal communication. Non-verbal communication, in this type of communication, facial expression through eyes, touch, and bodily gestures, etc. are included. Words are not used in this communication. Mono acting for imparting health education is an ideal example of this. Verbal communication ki, in this type, written or spoken words are used for communication. Verbal communication is two type: oral communication, this is done through conversation, telephone, interview, lecture, conference, and other social media, but unclear words and absence of permanent record can lead to misunderstanding and damage. Oral communication এটা তারপর written communication. For health education, written communication is done by posters, handbook, booklets, letters, newspapers, magazines, bulletins, and notice boards, etc. But the readers or viewers should be able to understand the language for effective communication. Second communication, one-way communication or didactic method, example lecture method, or two-way communication or Socratic method, example workshop, group discussion in etc. Verbal communication, oral and written communication, or non-verbal communication. Formal communication, informal communication, auditory or visual communication, or combined communication. Common communication including telecommunication and internet. Conclusion. It is mentionable that the term health education is used often synonymously with health education. Health communication provides information, education, motivation, counseling. It is also necessary for the persuasion of health topics, raising morals, health development, etc. Any organization, or including health organization, cannot run without communication. Principles of communication. Communication means exchange of information, ideas, feelings, or messages between two or more people. For effective communication, some basic principles should be followed. Clarity. Message should be simple and clear. Avoid difficult words and confusion. Consciousness, conciseness. Information should be brief and to the point. Do not add unnecessary details. Completeness. Give full information so the receiver understands properly. Incomplete message leads to misunderstanding. Correctness. Use correct facts, grammar, and language. Wrong information reduces trust. Uh, Courtesy. Be polite, respectful, and friendly. Good manners improve and communication. Good manners improve communication. Several consideration. Think about the receiver's level of understanding, culture, and feelings. Correctness. Concreteness. A message should be specific and definite, not vague. Feedback. Always check whether the receiver understood the message. Two-way communication is more effective. Appropriate channel. Choose the right method, oral, written, or visual, according to the situation. Active listening. Pay full attention, do not interrupt. Show interest through eye contact and noting. Conclusion. These principles help make communication effective, meaningful, and understandable, especially in fields like nursing, education, and healthcare. It is the last question, that is barriers in communication. Effective communication is necessary for the achievement of objectives of health education. So many times, obstructed or faulty communication can lead to undesired results. Hence, it is necessary to know the barriers of communication. These can be as follows. Linguistic barriers. These include incorrect message, faulty translation, use of technical language, etc. Psychological barriers. These include immaturity, hasty, clear, carelessness, prejudice, jealousy, lack of interest, failure of communication, poor retention power, fear, phobia, superstition, opposite thinking, etc. Organizational barrier. These include lack of organizational structure, incorrect policies, and lack of means of communication. Personal barriers. Lack of interest in communication, false promises, lack of knowledge, confidence, and time, fear of criticism, hearing impairment, and sensory disorder are included in this. Environmental barriers. Geographical distance, mechanical and electrical failure, sound pollution, and physical obstacles can block communication. Technological barriers. Network issues, network issues, technical faults, lack of digital knowledge. Example internet failure during online communication. How to overcome the barriers of communication. Overcoming barriers of communication means removing the obstacles that disturb clear understanding between sender and receiver. Ways to overcome the communication barriers are: use simple and clear language, avoid difficult words and jargon, speak in listeners level of understanding, active listening, pay full attention, do not interrupt, not or give feedback to show interest. Not means pay yes when someone you ask to yes or no. Ensure proper environment, reduce noise or distraction, choose a quiet and comfortable place, improve non-verbal communication, maintain eye contact, keep open your eye posture, use proper facial expressions and gestures, provide feedback, ask questions to confirm understanding, encourage the receiver to repeat or clarify. Cultural sensitivity. Respect different beliefs, languages, and customs. Avoid stereotypes or offensive words. Use appropriate communication channels. Choose face-to-face, phone, or written methods as needed. Ensure technology works properly. Develop confidence and knowledge. Prepare before speaking. Be clear about the message. Be empathetic. Try to understand the other person's feelings and viewpoint. Conclusion: overcome communication barriers by speaking clearly, listening carefully, staying calm and patient, reducing distraction, and respecting others' feelings and cultures. So, the video was made on the assignment on health education and communication.